Shoulder pain is common, and it's typically caused by inflammation or degeneration of the rotator cuff or the other tissues around the shoulder. It can keep you awake at night and make difficult, simple activities of everyday life, such as putting on clothing or lifting overhead. Fortunately, exercises that you can do at home can eliminate the pain. These are going to be demonstrated by the therapist from Saco Bay Physical Therapy.
Hi, I'm Gabriel Redmond with Saco Bay Physical Therapy, and Ashley and I are going to show you some exercises that you can try at home if you're having some shoulder pain. The majority of shoulder injuries that we see involve the rotator cuff, and so that's the first thing that we want to start working on, is getting some blood flow to that rotator cuff. Ashley is going to grab the green band, and she's going to demonstrate some internal rotation. The key with doing these at home is you want to make sure that your elbow stays nice and close to your side, and you're just gently pulling right across to the stomach. Now with these, we'll typically do anywhere from 10 to 20 repetitions with patients. Certainly if you're trying this out at home, you want to start on the lighter side with the resistance as well as on the repetition. So, starting with 8 or 10 would be totally fine. If you start to feel any pain, you'd want to stop right away. So it's working the strongest muscle of the rotator cuff. And what Ashley's going to demonstrate next is she's going to switch hands and she's going to start to do some external rotation. There's actually 3 muscles that externally rotate the shoulder. A little bit of confusion about the rotator cuff. It's actually a collection of 4 muscles, 3 of them that externally rotate, and then the stronger one that she was demonstrating first with the internal rotation. These exercises are great at stimulating blood flow to those tendons and muscles to get that healing process going at the fastest rate for you. What we're going to show you next is another rotator cuff exercise. It's a diagonal lift called a scaption lift, and we're going to bring that right up to shoulder height. The reason it's called a scaption lift is because it's kept in the plane of the scapula. Your shoulder blade actually comes off at a slight angle, and this lines up with that shoulder blade, engages what's called the supraspinatus muscle, which is kind of the captain of the rotator cuff, and it's also the one that is most likely to be injured if you do have an overuse injury or a strain of your shoulder. Again, these exercises, getting that blood flow to the shoulder. We're not even using weights in her arms because we don't need a lot of resistance. It's much more about the repetition and getting that muscle contracting and relaxing through a comfortable range to get that healing process going. That's really the difference between a therapeutic exercise versus a gym exercise. Excellent. Does that feel okay?
Yeah, it feels good.
This next shoulder exercise you can do at home lying on your bed if it's a nice firm surface. You can also try it on the ground as well. What we're going to do is we're going to have Ashley extend her arms straight up. We want to keep the elbows nice and straight, and it's all shoulder motion. What she's going to do is push her shoulders up, lifting them off the table, and this is engaging the serratus anterior muscle. It's what's called a serratus punch. As she's doing that, you can see her shoulder lifting up a few inches off the table. That's exactly what we're looking for. It's a fairly short motion. It's engaging a very, very important muscle. The serratus anterior combined with your trapezius muscle creates a muscle pulley for the shoulder blade. That stabilizes where the shoulder blade is in space. And again, when we're talking about the rotator cuff, all of those muscles, the rotator cuff muscles, come off of that shoulder blade. So we need to make sure that that bone is stabilized in space. And this is one of the primary muscles that's going to do that for you. At home, using a couple pounds is plenty to get this exercise started. You can use a can of soup if you don't have 2-pound weights. And you're probably looking at, again, between 10 and 20 repetitions to get that blood flow into that muscle and get the healing process generated.
These exercises are great, but if you don't get good relief over 3 to 4 weeks or develop increased stiffness or pain, you should seek help from your doctor or a physical therapist.